Hello, my name is Christina Brattain, and for my ARP, I decided to research iPhone connectable smart health devices. The iPhone connectable smart health device market is a fast-growing field that few people are aware of, and even fewer utilize in their lifetime. The main purpose of this study was to research these devices and to determine what technology succeeds as its intended function and what needs to be improved according to user reviews. This led me to my research question. What iPhone connectable devices are currently available for patients to monitor their health and share updated medical information with their doctor? The answer to this question is simple: iPhone connectable smart health devices. But you may wonder what an iPhone connectable smart health device is. I've defined the term as technology that can be synced through Bluetooth to an iPhone in order to monitor or track medical readings that often utilizes AI. The market started in 2008 when Fitbit released its first device, the Fitbit Flex. But the industry took off in 2014 when Apple introduced its HealthKit app, the very first version of what is known as the Health app. In 2014, the app was marketed as a hub for users' iOS fitness tracking needs. The smart health device market took off again a year later in early 2015 when Apple released its first Apple Watch that featured a heart rate sensor, accelerometer, and a gyroscope. Apple sold over 44.6 million units in the first year, showing the world the potential revenue accessible through the smart health device market. Since 2014, the market has expanded and many companies are competing to develop and improve consumer smart health devices. In 2018, 61 health companies reported revenues that were featured on the Inc. 5000 list that annually ranks the fastest growing private companies in the United States. A downside to the market is the high cost of developing and testing these devices that results in a high cost for consumers. Healthcare providers such as Aetna and United Healthcare are trying to help patients afford smart health devices. They currently offer eligible participants subsidized Apple Watches. By reaching goals each day, the user will pay back $4 every day until the device is paid off. This technology, along with innovative programs, have led to mergers like the CVS-Aetna deal, where they combined and partnered with Apple to create a personalized well-being program for the Apple Watch. The app will provide users personalized goals, track daily activity levels, and recommend actions to further improve health. Fitbit's newest device, the Vera 2, features a 6-day battery life, sleep, and 24/7 heart rate tracking, as well as Fitbit Pay. The device costs up to $180, and although this may seem like a steep price, it is much more affordable than the Apple Watch that can cost up to $1,200 before accessories. The Apple Watch has many of these same features, but additionally has the ability to read your heart rate and rhythm with a supported app to read your heart's electrical signals. The watch also monitors sound levels and can sense when the world around you reaches a noise level that may pose a risk to your hearing. Additionally, the watch focuses on mindfulness and breathing with its breath app that keeps the user centered by leading them through a series of calming breaths. However, many consumers need a device that can track their blood pressure from their wrists. Recently, Omron debuted a device that they claim is the first wearable blood pressure monitor that tracks hypertension. The Omron Heart Guide wearable blood pressure monitor pairs to the Heart Advisor app. It has all the features that the Vera 2, but additionally tracks blood pressure over time with color-coded health graphs and gives users daily insight based on personalized data. The app even compares users' reading to the American Heart Association and the American College of Cardiology to see where their readings compare to other patients. One of the newest fields in smart health devices is for new parents. Infants are most likely to experience a medical emergency within the first few months after they are brought home from the hospital. Thankfully, new baby monitors are being manufactured to help parents see fluctuations in their baby's health as soon as they occur, even if they are not physically noticeable or if they are away from their child. The Outlet Smart Sock monitors heart rate, oxygen levels, and sleep tracking that measures how long and well an infant slept. The sock connects to its charging pad that glows green if the child is in good health, yellow if there is a slight medical issue that may need attention, and red with alarms if a serious or fatal issue is detected. The second device is Nurofen, a smart health device that sticks to an infant's chest while they are sleeping with an abnormal body temperature or sickness. The device connects to a parent's phone and notifies them if the baby's temperature fluctuates outside of a preset range. A big portion of the smart device market is the need to monitor chronic life-threatening conditions and diseases. This groundbreaking market has gone from monitoring chronic issues to doing the work that can only be done by optometrists and expensive bulky equipment. With the DI smartphone-based retinal image system, buyers can identify glaucoma, diabetic retinopathy, cataracts, and papilledema with a user-friendly experience that allows the patient to monitor their eye health without regular visits to an optometrist. The app processes the results and notifies the user of any changes in their eye health. Another device is a small square that can fit in a pocket and can be used on any flat surface. The device is the Cardium Mobile by AliveCor. The device takes 30 seconds to record the results and can inform the user of atrial fibrillation and record 6-lead ECG. The supported app shows the users the results and reminds them to take their medication and keeps track of their medication history. According to the Center for Disease Control and Prevention, in the United States, between 2015 and 2016, the prevalence of obesity in adults was nearly 40% and affected about 93 million people. This can lead to heart disease, stroke, type 2 diabetes, certain types of cancer, and premature death. Fitbit released the Area Smart Scale to offset these problems. The scale recognizes up to 8 different people, automatically synchronizes and uploads readings to the app, and measures body mass using bioimpedance analysis. AdhereTech recently began manufacturing a bottle that reminds the users to take their medication with a text message or phone call. The bottle comes already supplied with the user's prescription and automatically contacts the pharmacy for refills to make sure the user's experience is as simple as possible. Another product is Nima, that debuted as the first portable food sensor that could identify gluten or nuts. To use this device, people who have allergies load a pea-sized amount of food, drink, or an ingredient into the device's cartridge. The device then runs a 30-second chemical reaction test to see if the sample contains any of these products. The results are displayed on the face of the device and additionally sends it through Bluetooth to the supported app on a user's iPhone. For my final product, I would have liked to inform the elderly members of my community with a presentation about these products in hopes that they can better improve any medical conditions that they may have, or that they can recommend a product to a friend or family member. In recent times, iPhone connectable smart health devices are needed more than ever with the rise of the COVID-19 pandemic. With the vast majority of the population in quarantine, few medical offices are open for checkups or other non-essential appointments. By using smart health devices, doctors can monitor patients by receiving home-taken test results and sending them to their caretakers. This reduces interactions that could possibly expose and spread the virus. Even after this pandemic is handled, these devices will reduce the need for patients to come into the office for routine checkups because most testing can be done at home without the assistance of a doctor or office visit because all vital information needed is already accessible at a patient's home through these devices. Since health readings are always readily accessible from a user's iPhone, people will be more involved in their health because they can better understand their readings and know what they mean so they can change them in the future.